Join me as I dive into the most shocking medical mistakes that have shaped modern healthcare and see if I can uncover what we can learn from them. Medical mistakes are an unfortunate reality in the healthcare industry. Despite the dedication of medical professionals, errors can and do happen, often with serious consequences. But what if I told you that some of these mistakes have had a profound impact on modern healthcare practices and patient safety? Today, we're going to explore some of the most shocking medical mistakes that have changed the face of healthcare forever. From misdiagnosis to surgical errors, medical mistakes can take many forms. But what's truly shocking is that these mistakes can have a lasting impact on patients, families, and even entire healthcare systems. As we delve into the world of medical mistakes, it's essential to understand that these errors are not just isolated incidents. They can have far-reaching consequences that resonate for years to come. And speaking of the impact of medicine through the ages, we've crafted a line of medical-themed designs inspired by these incredible stories. Head over to histoedutainment.com and explore our collection, which celebrates both the triumphs and trials of medical history. Whether you're a healthcare professional or a history buff, our designs let you wear a piece of this fascinating past. The importance of learning from these mistakes cannot be overstated. By examining the past, we can identify patterns, root causes, and areas for improvement. This knowledge can then be used to inform policy changes, update medical practices, and most importantly, save lives. So, let's take a closer look at some of the most significant medical mistakes that have shaped modern healthcare. One of the most common types of medical mistakes is medication error. This can occur when a patient is given the wrong medication, the wrong dose, or the wrong frequency. According to the World Health Organization, medication error is one of the leading causes of patient harm globally. In fact, it's estimated that the annual cost of medication errors in the United States alone is a staggering $42 billion. Another type of medical mistake is surgical error. This can occur when a surgeon operates on the wrong patient, performs the wrong procedure, or leaves surgical instruments inside a patient's body. The consequences of surgical errors can be catastrophic, leading to permanent damage, disability, or even death. Diagnosis errors are also a significant concern. When a patient is misdiagnosed, they may receive unnecessary treatment, which can lead to further complications. In some cases, a misdiagnosis can be fatal, especially if the patient has a time-sensitive condition that requires immediate attention. The list of medical mistakes goes on and on. From hospital-acquired infections to communication breakdowns, the opportunities for error are endless. But what's truly shocking is that many of these mistakes are preventable. With proper training, effective communication, and a culture of safety, many medical mistakes can be avoided. Let's take a closer look at some notorious cases of medical mistakes that have made headlines over the years. One such case is that of Henrietta Lacks, a poor African-American woman who died of cervical cancer in 1951. Without her knowledge or consent, her cancer cells were taken and used for medical research, leading to numerous medical breakthroughs. However, this raises serious questions about patient autonomy, informed consent, and the ethics of medical research. Another famous case is that of Quaid's twins, who were given a massive overdose of heparin in 2007. The error was caused by a packaging mistake, which led to the hospital administering 10,000 units of heparin instead of the intended 10 units. Fortunately, the twins survived, but this incident highlighted the importance of packaging and labeling safety in hospitals. The case of Christopher Van Epps is equally disturbing. In 2005, the 17-year-old boy underwent surgery to remove a tumor from his left lung. However, the surgeon operated on the wrong lung, removing Christopher's healthy right lung instead. This catastrophic error led to Christopher's death and sparked a wave of outrage against the medical community. In 2013, the Indiana University Health System experienced a devastating medical mistake. A hospital worker accidentally reused a syringe to inject insulin into a patient, transmitting a rare blood-borne virus to the patient. This incident led to a massive recall of patients who may have been exposed to the virus. The list of medical mistakes goes on and on. But what's truly remarkable is that each of these incidents has led to significant changes in healthcare policies and practices. For instance, the Henrietta Lacks case led to changes in informed consent laws, while the Quaid case led to changes in packaging and labeling safety. One pivotal moment in healthcare reform that emerged as a direct response to a major medical error is the creation of the Joint Commission's National Patient Safety Goals. These goals were established in response to the growing concern about patient safety and quality of care in hospitals. The goals provide a framework for hospitals to improve patient safety, reduce errors, and enhance the overall quality of care. Another significant development is the implementation of electronic health records, or EHRs. EHRs have greatly reduced the risk of medication errors, diagnosis errors, and other medical mistakes. They have also improved patient safety by providing healthcare professionals with instant access to patient information, reducing the risk of miscommunication and errors. As we've seen today, medical mistakes are a harsh reality that continues to haunt the healthcare industry. But it's how we respond to these mistakes that truly matters. By learning from the past, we can create a safer, more effective healthcare system that prioritizes patient safety above all else. So, what do you think about medical errors? Have you or someone you know been affected by a medical mistake? Share your thoughts in the comments below, and don't forget to check out our next medical history video.